How to use naproxen correctly, dosing science you can't ignore. Welcome back to HeInfo. In today's episode, we're diving deep into a crucial topic, how to use naproxen correctly. Whether you've been prescribed naproxen for arthritis, gout, or pain relief, using it the wrong way can lead to serious side effects. So let's break down what this medication really does, and how to take it safely, with science to back it up. What is naproxen? Naproxen, also known by its brand name Naproxen, is a non-steroidal anti-inflammatory drug, or NSAID. It's often prescribed in higher strengths than over-the-counter naproxen sodium. This medication works by blocking enzymes, COX-1 and COX-2, that produce prostaglandins, the chemicals responsible for pain, inflammation, and fever in your body. Doctors often recommend it to manage chronic inflammatory conditions like rheumatoid arthritis, RA, osteoarthritis, OA, ankylosing spondylitis, juvenile idiopathic arthritis in children, tendinitis, bursitis, gout flares, menstrual cramps, and general pain relief. How to take naproxen correctly. Here are the science-backed tips you absolutely need to follow. Always take naproxen with food or milk. NSAIDs like naproxen can irritate the stomach lining. Taking it on an empty stomach increases your risk of ulcers, bleeding, and GI upset. Stick to the prescribed dose and schedule. It's usually taken 2 to 3 times per day by mouth. Some formulations are delayed release, so never crush, chew, or break them unless your doctor or pharmacist says it's okay. Doing so can destroy the protective coating that prevents stomach damage. Expect gradual results. Pain relief may begin within hours, but swelling and inflammation might take a few weeks to improve. Don't stop too early, give your body time to respond. Avoid combining naproxen with other NSAIDs. Taking it alongside ibuprofen, aspirin, or similar medications dramatically increases the risk of stomach bleeding, heart attack, or stroke. Always check labels on cold or pain medications for hidden NSAIDs. Monitor your blood pressure. If you have hypertension, know that naproxen can reduce the effectiveness of blood pressure medications. Clinical studies confirm this interaction, so track your blood pressure regularly and consult your healthcare provider. Limit alcohol. Alcohol and naproxen together are a bad mix. Alcohol increases your risk of gastrointestinal bleeding, especially if you drink regularly. Side effects. What to watch for. In clinical studies, 3% to 9% of users reported common side effects like heartburn, stomach pain, nausea, constipation, dizziness, drowsiness, skin itchiness or bruising, ringing in the ears. Seek emergency help if you notice vomit that looks like coffee grounds, black tarry stools, or blood in your vomit or stool. These are signs of internal bleeding. Special considerations. Pregnant or breastfeeding. Avoid naproxen during the second half of pregnancy. Studies suggest it may lead to complications such as premature closure of the fetal ductus arteriosus or issues during labor. If breastfeeding, talk to your doctor. Naproxen can pass into breast milk in small amounts. Taking aspirin for your heart? Be cautious. Combining it with naproxen may increase the risk of GI side effects and might interfere with aspirin's heart protective benefits. Your provider will help weigh the risks and benefits. How to use naproxen correctly, dose by condition. For rheumatoid arthritis, osteoarthritis, and ankylosing spondylitis. Immediate release, 250 mg to 500 mg, or 275 to 550 mg naproxen sodium, twice daily. Controlled release, 750 to 1000 mg once daily. Delayed release, 375 to 500 mg twice daily. Doses may be increased up to 1,500 mg per day for short-term use, no longer than 6 months, if needed for stronger anti-inflammatory relief. Symptom relief often begins within 1 week, but 2 weeks may be needed for full benefit. For acute gout attacks. Day 1, 750 mg naproxen, or 825 mg naproxen sodium, as a single dose. Then, 250 mg, or 275 mg sodium, every 8 hours until the attack resolves. Controlled release, 1,000 to 1,500 milligrams once on day 1, then 1,000 milligrams daily. Delayed release forms are not recommended for gout due to slow onset. For tendinitis and bursitis, immediate release, naproxen sodium, 550 milligrams once, then 275 milligrams every 6 to 8 hours, or 550 milligrams every 12 hours. Max initial dose, 1,375 milligrams per day. Ongoing use, do not exceed 1,100 milligrams per day. Controlled release, 1,000 milligrams daily. Can be increased to 1,500 milligrams per day short-term if necessary. For menstrual cramps, dysmenorrhea, immediate release, naproxen sodium, 550 milligrams once, then 275 milligrams every 6 to 8 hours, or 550 milligrams every 12 hours. Max dose, 1,375 milligrams on day 1, no more than 1,100 milligrams per day afterward. Over-the-counter, 220 milligrams every 8 to 12 hours. You may take 440 milligrams at the start if needed. Max OTC dose, 440 milligrams per 8 to 12 hours, 660 milligrams in 24 hours. For mild to moderate pain, adults. Immediate release, naproxen sodium, 550 milligrams once, then 275 milligrams every 6 to 8 hours or 550 milligrams every 12 hours as needed. Max dose, 1,375 milligrams per day initially, then do not exceed 1,100 milligrams per day. Controlled release, 1,000 milligrams once daily. May go up to 1,500 milligrams per day for short periods, if absolutely needed. Long-term use should not exceed 1,000 milligrams per day. Over-the-counter, 220 milligrams every 8 to 12 hours. Optional, 440 milligrams in the first dose. Max, 440 milligrams in any 8 to 12 hour window, 660 milligrams per 24 hours. Delayed release tablets are not ideal for treating acute pain due to slower absorption. For fever, adults and children 12 plus. See only 220 milligrams every 8 to 12 hours while fever persists. Optional, 440 milligrams for the first dose. Max dose, 440 milligrams in any 8 to 12 hour window, 660 milligrams per 24 hours. Pediatric doses for pain and fever, 12 plus years. 220 milligrams every 8 to 12 hours. May take 440 milligrams as an initial dose. Max, 440 milligrams in any 8 to 12 hour period, 660 milligrams in 24 hours. Pediatric dose for juvenile rheumatoid arthritis, age 2+. Immediate release tablets or suspension, 5 milligrams per kilogram twice daily. Oral suspension is preferred for more accurate, weight-based dosing. Delayed release forms are not recommended for children under 18 years due to lack of sufficient study. Conclusion: naproxen is a powerful tool in managing pain and inflammation, but only when used correctly. Always follow medical advice, read labels carefully, and never self-medicate with other NSAIDs. Now you know how to use naproxen correctly, so you can relieve pain without risking your health. If you found this video helpful, be sure to subscribe to HeInfo for more expert-backed health tips. Got questions about other medications? Drop them in the comments, we might cover them next.